Good morning, everyone, and welcome. My name is Augusta Ratliff here with OCI. I'm the Benefits Operations Manager, and I am here to welcome Medica today. Pat is with us. He's one of our great partners that we get to work with, so we feel very lucky to have him in office. This is our first webinar. This webinar we will do monthly over different topics, be around the same time every single month. So we would love to see this thing grow as we continue throughout the year, really just informing all of you with great information. Today, you're going to hear about some association plans, Elevate Network, and growth that Medica is seeing. If you do have questions, you'll find a chat box at the top of your screen or perhaps on the side. Go ahead and put those in there, and towards the end of the presentation today, Pat will be answering questions. You can hold them till the end. You can type them up as you go, but we will open it up and make sure that everyone has some great information to leave with. You'll also be receiving a follow-up email today. You'll see some pieces of the questions that you guys have asked, some follow-up pieces as well. We will also send out any information on Elevate Network to make sure you're fully equipped for a wonderful 2025. With that, I am going to turn this over to Pat. This is also recorded, so if for some reason you have to leave early or you need some follow-up, you maybe missed something, we will have the recording that we can always send out as well. Thank you so much for being on today.
Thank you, Augusta. Hi, this is Pat Hefner calling with Medica. And first of all, I just want to take an opportunity to thank you guys. First of all, thank OCI for the opportunity for us to present. Also want to thank you guys and OCI for participating. We couldn't have seen the growth that we've had in Nebraska without your help and your confidence and your partnership. So first of all, thank you. We certainly do appreciate that. So next, I would like to talk about Medica really truly believes in giving back to the communities that we work in. As a company as a whole, we contributed $6 million to nonprofits across all the states that we do business in. That monies went to access for healthy food, mental health advocacy, and promoting health and well-being. In Nebraska, we contributed $1.1 million to Nebraska nonprofits all across the state. And as you can see, $120,000 of that went to food and nutrition security. $125,000 went to healthcare workforce development. $300,000 or almost $230,000 went to maternal and child health equity. $355,000 went to factors to improve health improvements, and then $300,000 went to behavioral health. The reason I bring this up is just to let you know, again, we do believe in giving back to our communities. If you do have a relationship with a nonprofit, maybe a food bank, or maybe that works in the behavioral health area, please bring it to us. Bring us ideas as to what we can do and what we can help Nebraska communities with. So we're certainly anxious and willing to do that. So first of all, the presentation today, we want to first talk about association health plans with Medica. We've expanded that recently, and so we just want to take an opportunity to review all of the options that we have on the association health front market. Then we'd like to talk about our ACOs, our accountable care organizations, and the growth that we've seen in that marketplace. And then lastly, we'll finish up with some national network changes that we have seen here recently at Medica. So as I mentioned, Medica has 4 association health plans that we have in Nebraska. And these association health plans are the Nebraska Dental Association, the Nebraska State Bar Association, and the Nebraska Trucking Association. All of these have came to us recently from another competitor, and we have had the One Health Nebraska Association Health Plan for many years. And so what these association plans, I think, will give you is multiple plan options as well as designs. And it's going to give you tiered pricing to accommodate the individual group needs. It's going to give you access to My Health Rewards, which is our wellness programs, as well as our industry-leading preventative drug lists are going to be included. And then the customer service that you come to know and expect from Medica. You may be asking yourself, why should I look at association health plans? Well, hopefully you're going to find that there's better risk spread with our association health plans versus our fully insured small group marketplace, for an example. You're going to find that hopefully you're going to see lower renewals because, again, the health of that block of business is a little bit better. If you have members of those associations that are active and passionate about those associations, again, it's a way for them to give back to those associations as well. So what I want to do is take an opportunity and review just some of the plan design options that are included with each association plan. Our Nebraska Dental Association and the Nebraska State Bar Association have the same plan design options, as well as have the same ability for multiple options and so forth like that. So you can see that there are 3 copay plans that are available with the Nebraska Dental Association, the Nebraska Bar, the Nebraska State Bar Association, as well as there are 4 HSA plans that are available. So your deductibles there are going to range from $5,000 up to $7,000. So hopefully what we feel is there's going to be a wide selection of plans that are offered. There are multiple plan options that are available. So if you have a group of 1 enrolled, they can have 1 plan as well as 1 network. For groups with 2 to 5 enrolled, they can have up to 2 plans, and all 3 networks would be available to them. And then if you have a group with 6 or more enrolled, they can have up to 3 plans as well as 3 networks. So the networks that would be included and would be eligible would be Medica Choice National, Elevate by Medica, and Medica with CHI. Information can be found. OCI is going to have information on all of these plan options that are available, as well as you can see, we do have information available on the Medica website as well. Next, I'd like to talk about the Nebraska Trucking Association. And here, there are different plan designs than the other 2. So we have 3 copay plans that are available, as well as 2 high deductible health plans, or HSA eligible plans are available. And there, your deductible is going to range from the $1,500 up to $7,000. As far as multiple plan options, it's going to be similar, where if you have a group of 1, they can have 1 plan as well as 1 network. If you have a group with 2 to 5 enrolled, they can have up to 2 plans and 3 networks. And groups with 6 or more enrolled, they can have up to 3 plans and 3 networks. Again, the networks are going to be the same. And again, that information, OCI is going to be able to provide any information from a plan design perspective, as well as SBCs that you're going to need to be successful in the association health plan marketplace. Next, I'd like to talk about our One Health Nebraska. One Health Nebraska is our largest association plan that we have. I apologize about that, operator error. It's our longest association plan that we have had. It's been with us multiple years. There we're going to have 4 copay plans that are available, as well as 4 HSA plans or high deductible plans that are available. You can notice that 2 of those plans have a deductible buy down. So they have an HRA that is built into that. The third-party administrator that we use for that health reimbursement arrangement would be Mid-American Benefits here in Nebraska. So again, for the One Health plans, you can have for groups with 1 to 5 enrolled employees, they can choose 1 plan. And with groups with 6 or more enrolled, they can choose up to 3 plans. The network that is included in our One Health Nebraska Association Health Plan is our Medica Choice National Network. And again, OCI would have information that is available within. And how do we get a quote? Requesting a quote, just your normal quote request goes through OCI as it normally would. If you have a group with 5 or more, or 5 or less enrolled employees, we're going to need the association health plan participation form. We're going to need the census. The OCI will help get it in the format that's necessary. We will need health history forms for groups with 5 or less enrolled employees, and we will take the uniform application. We're going to need their current SBCs as well as their current rates by plan design. Where if you have a group with 5 or more enrolled employees, that is a little different as to what we require for a proposal. So 5 to 100, we would need the association health plan employer participation form that would be required for each association plan, the census, the SBCs, as well as the plan designs. That census will GRX and provide that proposal via that requested census. And if you have a group with 100 or more enrolled employees, there, about the only difference we're going to need is we're going to need their most recent 12 months of claims data, including a breakdown of total membership, high claimant information, the items that you're normally are going to see from a group of that size. Other than that, OCI is going to package it up. They're going to send it on to the appropriate area, whether it be One Health Nebraska or Medica directly, and they will start the generation of that proposal for you. Next, I'd like to take an opportunity and talk about our accountable care organizations that we do have, and we have had some additions to our accountable care organizations in Nebraska. So first of all, let's talk about what an ACO or accountable care organization is to Medica. First of all, what you're going to see is some savings. Our ACOs, whether it be Elevate or Medica with CHI, is going to deliver 20% savings compared to a group that has Choice National. So they really are going to see some substantial savings from a premium perspective in doing that. What it also does is we're seeing our experience is a lot better. It's going to drive trend that is reduced. So the trend of our groups that are in an ACO is running better than what it is with our full networks or our Choice National networks. We're seeing lower readmission rates within hospitals, which again equates to lower costs. We're seeing higher breast cancer screening rates, higher colorectal cancer screening rates. We're seeing lower emergency room visits, as well as we're seeing higher well child visits. And all of that, we're seeing some of the costs go down, but as well, what we're seeing is member satisfaction is just as high, if not even higher than in the other plans. We have 1,200 commercial ACO groups nationwide with Medica, and those groups that are in an ACO are continuing that upon renewal. 95% of those are renewing into those same plans. So our ACOs really are giving our members the care they need at a price that's better than our full network, and that is providing a satisfaction which is super good, and it's really nice. So the first ACO I'd like to talk about is the one that we've expanded recently, and it's called Elevate. Elevate has been very successful. We blew away the projections as to the number of employees that have selected Elevate as an option for them. So as you can see, Elevate we've had on the individual side, basically in the Lincoln and the Omaha marketplace. What we've done is expanded that on the group side all the way out to the Grand Island and the Kearney and the Hastings area, as well as we've expanded into Iowa. So the expansion of Elevate has been very successful. Some of the additions that are come in, you're going to find in the Elevate network is going to be the Grand Island Clinic, Central Nebraska Orthopedic, Grand Island Regional, Kearney Regional, Jefferson County Memorial, Family Practice of Grand Island Memorial Hospital. In Lincoln, it's going to give you access to the Bryan Network. In Omaha, it's going to give you access to the Nebraska Medicine Network, as well as the Methodist Network and Children's. So from a network expansion, it really has expanded our ACOs and really expanded the opportunity for groups to sharpen the pencil from a rate perspective. The rates for our Elevate network are going to be the same as the rates for CHI. So if you're in an area where CHI is available, as well as Elevate is available, you can have all three networks. So you can offer Choice National, Elevate, as well as CHI. And the Elevate and the CHI rates are going to be exactly the same. So you're really working with three networks, but two sets of rates. So it really has been beneficial. Here is an example, it kind of shows you what the service area is for the different networks that we do have. So you can see the Elevate network is going to go out to all the way from Lancaster, Seward, York, Hamilton, Hall, and Buffalo, and then that row down, as well as it's going to expand into the Iowa marketplace in the 5 counties there. The CHI is a little more developed network, and it's a little bit more expanded. So it does have a greater service area that would be available. And I think what you're going to find with us is we're going to look to expand the Elevate network if and where it is applicable, and it certainly makes sense. Keep in mind that with our ACOs, both the Elevate network as well as the CHI, some of those hospital systems do have some skin in the game. So it may not be an option for every provider out there. They may be a little selective as to who they want in their network, because they want to make sure they can work with them to be able to keep costs down, as well as keep their services and the members' access to care up, as well as the member satisfaction, to work on that. Apologize. So with that, I want to talk about the next change that we had that occurred was we also changed national networks. And so in the past, we used First Health as our nationwide network or our travel network. We had switched that to United Healthcare's Options PPO. And what that really gave us is a much more recognized network nationally, as well as a more robust network, as well as a network that's going to provide us with deeper discounts. So we started this process in September. As groups for new business, September 1 and thereafter, our national network changed to United Healthcare's Options network. As groups renewed starting in September is also when those groups rolled over from the First Health network over to United Healthcare's network. So that will continue throughout 2025 until we have all groups moved over, which will occur in August of this year. One thing to keep in mind is as those groups are renewing, they will be receiving new ID cards as well as new ID numbers. So please let them know that they will be getting new ID cards and new ID numbers. They're going to be coming in a plain envelope. It's not going to say Medica. It's not going to say member ID cards enclosed. Just have them watch their mail before their renewal. And we want to make sure that they're using those new ID cards and not throwing them away. Next is, oh, shoot. I apologize. There was an error. I guess the next portion that I'd like to mention is that we rely on the producers in the field as well as OCI to give us ideas as to what we can do to improve and to get better. So with that, your ideas and your thoughts are key in helping us be successful, to have offerings that you guys and your clients are going to need and deserve. We strive to be your strategic partner. And so with that, if you do have ideas, please bring them to the OCI staff and their team and let us know what we can do for us to be successful. With that, let's see what questions that we have. Okay. So it asks, one of the questions that came in is the standard rewards program embedded to the association plans? And the answer to that question is yes. The standard rewards program is embedded. So the My Health Rewards standard program is embedded into the association plans. There unfortunately is not a buy-up option. We do have a buy-up option that's available for our fully self-funded cases, but we don't have any for our fully insured cases that we do have. I will wait a minute and see if there are any other questions that anybody has. We do have a question that talks about 5,500. We'll reach out to you directly and provide that information. The next question, are our association plans fully insured or level funded? They are fully insured plans. The next question is, the current broker benefit focus login includes all employees from all entities under one login. Will that change to allow different groups between specific portals? That is information that I'm going to have to gather from our account management staff. Unfortunately, I don't have the answer for you, but we will definitely find that out and we'll get it to you. Are there other questions? With that, I don't see any additional questions. As always, if you do have additional questions, please do not hesitate to reach out to OCI. They're here to provide you with support. They're here to provide you with the answers and the needs and the services that you need and deserve. So please don't hesitate to give us a call or give OCI a call. Again, we appreciate your guys' time today. Hope everybody has an excellent afternoon, and thank you for writing Medica.